Hi, my name's Taylor. I'm going to be your nurse today. We're going to be doing the full head to toe assessment, so I'm going to evaluate you from your head to your toes. You're going to be sitting, lying down, and standing up. Is that okay?
Yes.
Can you tell me your name and date of birth?
Jeff Nation, 5'10", 78.
All right, and where are you at today?
Madisonville College.
And who's our president?
Donald Trump.
Awesome. And get your blood pressure. I'm going to find your brachial. It's a +2 in regular. Alright. It's 128/78. Already. Are you in any pain today?
No.
Alright. Do you have any questions for me before we fully get started on it?
No.
His radial pulse is a +2 and regular. His pulse is 72. And you have respirations of 16. Alrighty, can you stand up for me? Hold out your arms and move your wrist around. Alright, can you do it again? Full range of motion of the wrist, and he has no deformities of the wrist joints. Can you bend your arm, straighten it, bring it in and out? Full range of motion of the elbow. Bring your arms up to the side of your head, touch your ears, out, in front, and behind. Full range of motion of the shoulders. Can you push my hands? Can you pull my hands? Can you push my hands? Can you pull my hands? Alright, can you shrug your shoulders? He has a muscle strength of a 5 in his wrists and his arms, and he also has a muscle strength of a 5 in his shoulders, and his cranial nerve 11 is intact. Can you stick out your foot for me and spin it around? Alright, can you do it again? No abnormalities or popping or crepitus in the joint. He has full range of motion in the ankle. Can you bend your knee up? Can you bend your leg out? Can you abduct and then adduct your leg? Alright, full range of motion of the knee and the hip. Can you have a seat for me? Okay. Can you push my hands? Can you push my hand again? Muscle strength of a 5 in the foot. Can you push my hand? Can you pull my hand? Muscle strength of a 5 in your leg. Also, I'm going to do your quadriceps reflex. Can you close your eyes? That was a slight reflex. Okay. Now, I'm going to check your arm. Can I see your arm for me? Thank you. And I would check this all bilaterally. His hair is evenly distributed. His skin is warm, dry, intact. It's soft and smooth. There's no masses or lesions present on his arm. His skin turgor has immediate recoil. His cap refill is less than 3 seconds. I'm going to check your leg. His hair is evenly distributed except for like one little spot on his leg. There's no edema present. His hair or his leg is warm, dry, intact, soft and smooth. No masses or lesions. Okay. And now I'm gonna look at your face. His eyes are symmetrical to his face and to each other. His nose is midline and symmetrical. His mouth is midline and symmetrical to his face. His ears are symmetrical and to each other and to his face. Can you hold out your arms for me? All right, his arms are symmetrical, and can you hold out your legs? His legs are symmetrical. His head is normocephalic and round and symmetrical. Can you rotate your neck around? It's full range of motion to the neck. Can you push my hand? Can you push my hand? He has a muscle strength of a 5 in his neck. Okay. Now, can you open and close your jaw for me? There's slight popping in his jaw. His temporal mandibular joint has popping in it. And also his cranial nerve 5 is intact. Can you close out your cheeks? Can you smile? Squint? Cranial nerve 7 is intact. All right, I'm gonna feel your temporal artery. They're +2 and regular. Is there any pain here in your frontal sinuses?
No.
All right, no pain or swelling or redness. How about your maxillaries?
No.
No pain, redness, swelling in his maxillaries either. Now I'm gonna look at your eyes. Can you close your eyes for me? His external structures are intact. His eyelashes and eyebrows are evenly distributed. His sclera is white. His conjunctiva is moist and pink, but bilaterally. His pupils are 3 millimeters. They are round. They're symmetrical to each other. All right, I'm gonna check for your direct response. So I'm gonna watch for it to constrict in this eye. All right, and then I'm gonna do consensual. So I'm looking at the other eye. Both are intact. Can you look at the wall behind me and then look at my pen? All right, his eyes have accommodation. Can you follow my pen for me? We're doing the 6 cardinal gazes. Cranial nerves 3, 4, and 6 are intact. All right, I'm looking at his nose. There's no lesions or masses on his nose. Can you look up for me? His nasal mucosa is pink and moist. There's no drainage, lesions, redness, or swelling or polyps in his nose. His septum is midline and not deviated. All right, can you hold one side and breathe in? Hold the other side, breathe in. Can you close your eyes for me? What do you smell?
Alcohol.
All right, cranial nerve 1 is intact. All right, now I'm put on gloves. I'm gonna feel your head. All right, is there any pain, tenderness with your head?
No.
All right, I don't see any parasites. There's no flaking. His hair is evenly distributed across his hair. It's short, and the color is correct for ethnicity. And when I check his arm is also correct for ethnicity with his color, along with his leg. Alrighty. I'm gonna put on gloves again, because I'm gonna check him out. Alright, can you open your mouth for me? The floor of his mouth has pink and glossy with the vessels intact. His teeth are present and no absent teeth. His buccal mucosa and his gums are pink and moist and intact. Can you stick out your tongue and say ah? His uvula moves with speech midline. His tongue is pink and moist and it moves midline. Can you stick out your tongue for me again? His tonsils are +1 and they the hard palate is light pink and the soft palate is dark pink, and they both are intact. And can you swallow for me? Okay, cranial nerves 12, 10, and 9 are intact. All right, I'm gonna look at your ears. Is there any pain in your ears?
No.
Alrighty, I'm gonna look in, see if that's one. And I'm looking at your canal. There's no lesions and there's no redness or swelling in there. Look up and back for your tympanic membrane. Okay, it is translucent and pearly white, and there's no polyps, masses, or lesions on his outer ear. All right, can you hold your hand over one of your ears? I'm gonna say a word and I need you to repeat it back for me. Peaches.
Peaches.
That's correct. So your cranial nerve 8 is intact. All right. I'm checking your carotid, and it is a +2 and regular. Your trachea is midline and not deviated at all. Can you turn your head to one side? Can you do it to the other side? All right, no JVD noted and no pulsations. He has no masses, lesions. Is there any pain in your neck?
No.
Okay, no pain noted. All right, what about your chest? Does
No.
any of this hurt?
No.
Any of this hurt?
No.
Can you take a deep breath for me? All right. Can you take another one? Okay. His breathing is even and unlabored, and his configuration is 2 to 1. So now there's no masses or lesions, so now I'm gonna listen to your lungs on the posterior side. Just breathe normally. 1, 2, 3, 4, 5, 6, 8, 7, 8, and 9. Bilateral, or clear bilaterally on the posterior with no adventitious lung sounds. Now I'm going to listen to the front. No adventitious lung sounds on the anterior, and they are clear bilaterally. So now I'm going to listen to your heart sounds. So I'm going to go to the right side, second intercostal space on the sternal border. Listen for its aortic valve. So now I'm going to go to the left side, second intercostal space, sternal border for the pulmonic valve. Now I'm going to go to the third intercostal space on the sternal border on the left side for his Erb's point. Then I'm going to go to fourth intercostal space on the left side sternal border for his tricuspid valve. And now in his fifth intercostal space on his midclavicular left side, I'm listening for his mitral valve for a whole minute. Alright, 74 beats per minute, no murmurs are present. His lung sounds or his heart sounds have no adventitious sounds in there, and there's no murmurs, and they have a regular rhythm. So now can you lay down for me? Alright, I'm going to go to your right lower quadrant and listen. And then your right upper quadrant. Then we go to your left upper quadrant and your left lower quadrant. He has normal active bowel sounds. I listen for a full 5 minutes in every single quadrant. Is any of this hurt or tender?
No.
Okay, there's no masses or wounds or hernias on his stomach. It's flat and soft. It's not distended. His umbilicus is inverted, and there's no pulsations noted. When was your last bowel sound? Or when was your last bowel movement?
Yesterday.
All right. Any problems with urination?
No.
Okay. You can sit back up for me. Okay. So now all I'm going to do is I'm going to put on gloves and I'm going to check out your feet. And then I'm going to do your nose. feel back here for your popliteal pulse. It's a +2 and regular. Then I'm doing your posterior tibial. And that's +2 and regular. Now your dorsalis pedis. That's a +2 and regular. There's no wounds, masses, or lesions on the feet. His toenails are intact, no fungus noted. Is there any pain in your feet?
No.
Alright, no pain or swelling. Alrighty, I'll take off my gloves. Okay, and the last thing I'm going to do is I'm going to check your cervical nodes and then your epitrochlear node. Alrighty, here we are. So right here is where your epitrochlear node is. It's not palpable. So now I'm going to do your cervical nodes. So you have your preauricular, your postauricular, tonsillar, superficial cervical, deep cervical chain, supraclavicular, posterior cervical, your occipital, submandibular, and your submental nodes. None are palpable. Do you have any questions for me?
No.
All right, thank you so much.